Good morning. Today we'll be talking about the thyroid. As the World Thyroid Day is coming up with the theme, it's not you, it's your thyroid. Thank you, Dr. Bankole, for coming on the program to talk to us about the thyroid. And also we have Iruoma here with us. But first, starting with you, Dr. Bankole, can you tell us, what does the thyroid do? Why is thyroid such an important organ that we have to have a World Health Day to discuss it?
Thank you, my host. Thyroid is a gland in the body, actually located on the anterior part of the neck. It performs a whole lot of function. Almost every function in the body depends on the thyroid gland. Basically, the major function of the thyroid gland is to do what we call metabolism. It assists in metabolism. What I mean by that is the food you eat, we take our food by mouth, then that food goes through a process, digestion, and then later is converted to energy. That energy you use it to do, you want to work, you want to do work, and you want to do a whole lot of things. You need energy. So without the thyroid gland, you will not be able to convert the food to energy, which you also use to do every other thing that you have to accomplish. So in summary, thyroid gland is organ that is involved in metabolism, which is the process by which our food is converted to energy.
Well, that actually sums it up in a nutshell, because without energy, we can't actually function. And so that's really, really key. Now, there are different issues that happen with the thyroid. Can you, there's hypothyroidism, hyperthyroidism, different kinds of issues to do with the thyroid. So I know it's a very broad one, but can you kind of explain what happens in low thyroid and high thyroid so that we could sort of understand it a bit better?
Yeah, thyroid diseases are broad and wide. Starting with excessive functioning. This thyroid gland you have, it produces some hormone in the body. Those hormones are the ones that are responsible for those metabolism. So this thyroid gland, if those hormones are produced in excessive amounts, they function excessively, more or less that the organ is functioning too excessively. We call it hyperthyroidism. If the hormone that is produced is not adequate, is not enough to subserve our normal function, that means the function is not optimal. It's not optimal, so we call it hypothyroidism. So that is another disease. There are other diseases. So most of the thyroid diseases will either present as hypothyroidism or hyperthyroidism. There are also a third category in which, yes, the organ may be diseased, may be functioning normally, but other diseases can arise, which I will talk about in due course.
So talk about them, please. Just start talking about the different kinds of disorders so that we can just have an understanding of them and what kind of symptoms can present.
Yes, I will start by just talking to you briefly about the anatomy of thyroid gland.
Okay.
Everyone, whether man or woman, young or old, has what we call thyroid gland, which is an organ in the anterior part of the neck. It develops while we are still in the womb and grow gradually. It's developed from there's a part of the body that we call pharynx, that is inside the depth of the mouth. So it developed there in the primitive pharynx. As the baby is developing, the thyroid gland starts developing. So it develops more or less in the floor of the mouth, and then gradually descend down to the position where it is at the anterior part of the neck at the time of delivery. So now, in the process by which this thyroid gland is formed could be defective and lead to a thyroid disease. The thyroid gland, when it is formed, its function may be defective, leading to a variety of thyroid diseases. I'll start with the formation, the development of the thyroid gland. Some children, a child may be born without development of thyroid gland at all. It won't develop. We call it thyroidogenesis or dyshomogenesis, thyroidogenesis. So it can occur in children. In some people, the thyroid gland is formed, but it's not able to function at all. So it's not able to produce any of those hormones that it should produce. So such people are going to manifest with symptoms of a lack of thyroid gland, or what we call hypothyroidism. Now, when the thyroid gland is formed, the pathway of its development, remember I said it develops in the floor of the mouth and then descend gradually down to the neck, to the anterior part of the neck. So this pathway through which it descends, there is a cord, it's like a tubular structure that holds the thyroid gland down. So it may get arrested along the way and it may get arrested at the floor of the tongue, such a way that it didn't get down to the anterior part of the neck. So that is abnormality of the location of the thyroid gland. Then when the thyroid gland is formed, usually every part of the body undergo what we call apoptosis, every cells in the body. That is regulated cell death. So at times, so when a particular part of the body does not undergo, that regulated cell death does not go in accordance with the way it should go. And then some cells continue to grow continue ab initio, they continue to grow unregulated. That unregulated cell growth is what will gradually develop into what we call cancer. So thyroid is also not immune to development of cancer. Cancer can form within the thyroid gland. Other diseases that can happen in thyroid gland has to do with its function. So like we said, if the organ is functioning, is producing excessive hormone, hyperthyroidism, like in the condition that we call grave disease, so the person can present with goiter. Goiter is a general term that is used to describe enlargement of the thyroid gland. So when we say goiter, it just means enlargement of the thyroid gland. So any of the thyroid diseases, be it hyperthyroidism, hypothyroidism, thyroid cancer, or any form, will usually present with anterior neck swelling in addition to other symptoms. So if you have abnormality of functions like hyperthyroidism, patient may present with a variety of symptoms, which I will talk about. If a patient presents with hypothyroidism, patient will also present with some symptoms, which I will talk about. So what are the things that cause all these thyroid diseases?
Can you just, as you're talking about it, because hyper and hypo are very important, just mention the symptoms now. What kind of symptoms present for hyper? What kind of symptoms present for hypo?
Yes, when a patient has hyperthyroidism, all of them, most of the time, they will present with anterior neck swelling. So in addition to the anterior neck swelling, patient with hyperthyroidism may present with what we call heat intolerance. You know, the thyroid gland is functioning excessively, the metabolic process is increased, so they are producing a lot, the body is producing a lot of heat already. So such patients will not be able to tolerate the normal environmental temperature that such patients ordinarily would tolerate. So they are what we call heat intolerance. What that means is that an environment that other people are not complaining that it's too hot. A patient who has hyperthyroidism will complain, oh, this place is too hot. You see such patients using fan to blow while others are comfortable in that environment. Patients with hyperthyroidism will have weight loss. They lose weight. At times, they may be eating normally or even eating more than usual, more than normal, but yet they continue to lose weight. And in fact, some of the patients are presented that way. They may present in such a way they look like skeleton. You can see their ribs, you can see their bones, and that is hyperthyroidism. So other symptoms they present with, they are usually anxious. They have anxiety. They may be irritable. Small things that otherwise other people would just take lightly. They get easily angry, get agitated. If that symptom continue, some people may show even feature of psychosis, that feature of mental illness, when that agitation and irritability continue. Such patients who have hyperthyroidism may be tremulous. They'll be shaking, anxious, the hand will be shaking. They usually have sweaty palms. Their hand, when you check the palm, will be sweaty. Other things may involve a menstrual irregularity. Some can even present with infertility, issue of infertility or pregnancy loss. So those are some of the features a patient who has a hyperthyroidism will present.
That's
By
very interesting because you
in
see,
the
we've also come up with a wide variety of symptoms, and that's why this year they're saying it's not your it's not you, it's your thyroid. There's such a wide range of symptoms you've already presented as hyper, and you're about to talk about hypo. So people can see that it's something that can easily be missed, misinterpreted, and yet can all still be the thyroid. Please tell us about hypothyroidism.
the hypothyroidism is just the flip of the what we have talked about earlier. So the patients may not be eating enough, but yes, they are gaining weight. Patient who has hypothyroidism, they are usually too slow. They are too slow. They may be somnolent. They may sleep excessively. Just realize that your colleague in office is just sleeping more than usual. So you may need to check the neck. They have or evaluate the thyroid gland. Such patient may have hypothyroidism. Patient with hypothyroidism may not be eating much. They also usually disinterested in the environment. They may when the disease progress, they may have leg swelling. They may also have mood swing and mood changes. And like I mentioned in a hyperthyroidism, the flip of heat intolerance is cold intolerance. So patient who has hypothyroidism, they are usually not able to tolerate excessively cold, even an environment that is not even excessively cold. The usual environment that has normal temperature, they may complain that it's too cold for them. So those are some of the features, and they may also have a problem with their menstrual cycle. They may go on several months without menstruating. So those are part of the thing a patient with hypothyroidism will present.
Thank you so much. That has been so comprehensive, so quickly, and yet so succinctly done. We really appreciate that quick summary of thyroid diseases. Can you just quickly tell us how a diagnosis of the malfunction of the thyroid is diagnosed?
If you permit me, I think I'd like to talk briefly about the causes, which I think we've not
Yes,
really
of
talked much
course.
about. The causes of thyroid diseases. For hyperthyroidism, condition like Graves' disease, which is an autoimmune disease. And what we mean when we say autoimmune disease, it's like body seeing itself as if it's a stranger, as if it's foreign. So you have cells of the body attacking its own. So patients with Graves' disease, they may present with feature of hyperthyroidism. Other people who have what we call another autoimmune disease, Hashimoto thyroiditis, they can present with that. Other thing that can cause hyperthyroidism is what we call there even ordinary viral or bacterial thyroiditis. That's the bacterial inflammation of or infection of the the thyroid gland can cause hyperthyroidism. Then other things that can cause hyperthyroidism include the use of some drugs. Patients who are on some antihypertensive like amiodarone, because they contain exogenous iodine, so they may present with feature because that leads to more or less like excessive iodine ingestion. So they present with hyperthyroidism. Patient who some cough syrup come with iodine as part of their constituent. So excessive ingestion of some cough syrup, such patient may present with hyperthyroidism. Hypothyroidism, on the other hand, may come usually, especially in the 80s, in the 70s. When we were growing up, there were some patients that would come with excessively large anterior neck mass. And it was so common in the locality where I grew up. And having been a doctor, then I realized there's an entity called endemic goiter. So that is in a particular locality, you have about 10% of the populace presenting with goiter, that's anterior neck mass, that's enlarged thyroid gland. So, and at that time, several studies then show and conclude that the soil in such environments, which are now known as goiter bed, which cut across part of Ondo, Ekiti State, Delta, Edo and part of Kogi State. They are called goiter beds. And it's also common in area, mountainous region, people who have, in which the soil, the water level is very low. So they have this, they are so usually deficient in iodine. So because of that widespread deficiency of iodine, so most people in those areas called goiter bed came down with anterior neck mass, that is goiter. So what I've said in essence is that iodine deficiency is also a cause of goiter. But of course, with the advent of iodinization of almost all our diets, salt, iodine, sugar, iodine, so we have gradually have less in the incidence of those endemic goiter.
That's very good. Thank you very much. Thank you, Iruoma, for coming on the program.
Thank you so much, Dr. Pamela, for having me.
So you are a survivor, a thyroid survivor. Can you tell us how you found out quickly, how you found out you had thyroid, what were your symptoms and signs and so on? And then what made you start the foundation that you run currently?
Okay, thank you very much, Dr. Pamela. I wouldn't say that I found out I had a thyroid issue early enough, because it was there for a long time. You know, like Dr. Bankole narrated, I started having some psychological symptoms first. That is irritability, tremors, and anxiety. But I knew that something was happening to me, but I didn't know what was happening to me, because I couldn't just imagine it, and people around me could not even understand what was happening to me. Rather, I was abused. I was labeled. I was let me say I was abused, because many people were running away from me because of the way I just changed. Even my husband, it affected my relationship with my husband. A little thing, I began to, I will flare up. And another thing is that I have 3 children, but as at that time, I wanted to take him for another. Our wish was to have 4 kids. But when we wanted to have the 4th one, it became a problem. But we never traced it to thyroid issue, because I didn't know what was happening. I was looking normal, but all of a sudden I started losing weight also, unsolicited weight loss. And I was eating very well. I wasn't exercising as such to say, I ran out of my normal routine until I started presenting some clinical symptoms. My eyes started bulging out, and and I started having a swollen neck. My neck started swelling. You know, by the day, it continued to increase until one of my bosses in the office now became worried and was like, "What's wrong with you? Go to the hospital, go and check your eyes." So from there, I went to the eye clinic. That was where the consultant gave me, she just looked at me. She didn't even examine me. She just gave me a paper to go for a thyroid function test. So that was how I went for the thyroid function test. And I was diagnosed of what they call hypothyroidism. From there, I now started, they directed me to a medical expert who was taking care of him, but he couldn't handle me. I wasn't getting well. I wasn't improving. And this thing I'm saying spanned through 4 or 5 years before finally somebody met me and was like, "Oh, my mother had this thing that you are having now, and I want to direct you to where you will be cured." And that was how my solution started, when I met the endocrinologist that took care of me. And he treated me, but he started with the psychological and emotional support before I got to know, because all I was thinking was this was how I was going to die. Oh. I never knew I had a solution. But because of the way the doctor talked to me, the way he handled me, the way he treated me, he gave me hope. I started even having the hope that I will still live again. Oh, this thing has a solution. So that's it.
I
That's my
think
journey.
that's wonderful, because in fact what you have actually illustrated is the importance of what is this theme is about. It's not you, it's your thyroid. So all that you went through for all those years, all the pains you suffered, all the issues, all the rejection, all the trauma, was not you, it was your thyroid. And so I'm so happy that at least you have that, that solution has been found for you. And I know you're running something, your foundation, you set up a foundation and you're running something coming up this thyroid day. What is it that you're running, so that our listeners, if they want to join in or get involved or know more about it, what is it you're doing?
Okay, thank you very much. You recall I said that I went through all this without knowing what was happening to me. People around me did not, and the few doctors around me that were treating me were just not treating me very well to get the desired results. So after surviving it, the doctor that treated me, it took him like 4 months to give me the drugs that reversed my thyroid values to normal. And I went for my surgery, and here am I, looking good. So after surviving it, and I started thinking about people that would be in the same position, that will be suffering from what has, or potentially will suffer from what I suffered, because it won't end in one place. It will keep, it will keep affecting people. So I just set up a foundation called Thyroid Awareness and Support Initiative, to use it as a platform to, bring awareness of thyroid disease in sub-Saharan Africa, because I even found out that I couldn't get any resource from within this Africa, even support group. So that is why we did not end up there. We have a support group where we learn and relearn and exchange ideas and experiences. So now the organization has grown. We are 4 years in Nigeria, and every Thyroid Awareness Day, we bring up awareness programs. We have International Thyroid Awareness Week that starts from 22nd of May to 28th of May. And we have fixed 2 major programs, basically to bring public awareness on thyroid health and also harvest people that are suffering from thyroid disease. Then we
What
have
are
a
the
program.
programs? Did you tell us quickly? What are the programs
Yes,
you've set up?
we have a program on we have a public lecture on the 25th of May. Then another one is the Thyroid Awareness Walk, Awareness Stroke Charity Walk on the 28th of.
Where can people listen to the talk? Is it online? Is it physical? And if they can join in, because unfortunately the program is almost ended. So you need to just, let us know quickly. Where is it taking place? Where can people join us?
The program is taking place, the public lecture is taking place at NECA House, Central Business District, Ikeja. That is opposite Fela Shrine. We're going to do it hybrid.
What time?
10 o'clock, 10 a.m. in the morning, 10 a.m. So we're going to do it in such a way that people that cannot come physically can key into the program through Zoom, hybrid.
Okay. How will they get the link?
We're going to send it through all our social media handles and our flyers. Yes. We have Facebook, Thyroid Awareness and Support Initiative. Then Instagram, we have Thyroid_Awareness Nigeria. Thyroid_Awareness Nigeria.
So if they can join you there, they can find it.
They can find the link there. From tomorrow, from anytime, from 1 week before the date, we're going to release the link for the program. Yes.
All right. And so those dates, just remind us, are May what and what?
May 25th and May 28th.
Thank you very much. So Dr. Bankole, if you don't mind, just to wrap up, unfortunately, time has just flown by. Do you have any last words for our listeners?
Yeah. Thank you very much. When a patient is diagnosed of thyroid disease, we make a diagnosis by running some tests. Then part of the treatment involves using drug and then surgery. And there have been many survivors. We have a lot of testimony, and the myths around that surround thyroid disease or goiter has already been broken, and then I can assure you that a knife can be put around patients to keep them alive.
Okay, thank you very much. So for all those who are interested in learning more, you can visit the handles that were described by Iruoma and join the thyroid awareness programs coming up this year. Thank you so much for being with us.
Thank you for watching. Please like, share and subscribe for new video updates.